Once again, our role as a healthcare provider is just education. A person who is an adult and can make his own decisions certainly has a right to decide if they would like to seek alternative therapy, if they prefer. So all we can do is just educate them as to possible interactions with other meds and cautions like don't use aromatherapy oils near eyes. As nurses, we want to read the labels of our patients' herbals and check the product package insert, the information that's put in with all prescription drugs, to see if specific herbals are mentioned. And the following herbs that I have kind of in bold print have traditionally been shown to give these particular results. St. John's wort will naturally increase the amount of serotonin in the body, and so it can be helpful for depression. However, it can also interfere dangerously with other drugs that increase the amount of serotonin in the body. We'll talk about serotonin syndrome in chapter 10, but it can be fatal. Echinacea is thought to somewhat improve immune function. They used to really push it back in my youth as something to prevent colds and flus. Now they're finding out it's not quite as fabulous as they thought it was, but people still add it to different herbal immune system boosts. Ginger has traditionally always been really good for nausea, vomiting, motion sickness. You know, when you were a kid and you had stayed home from school with a stomach bug, mom would give you crackers and ginger ale, and that usually helped. Chamomile. Chamomile is an antispasmodic, so it can make the GI tract feel better. It's thought to help prevent infections. Garlic has a lot of antiviral and antibacterial properties, but all of these herbs, while they may give good benefits, they are, if they give good benefits, it's because they have a therapeutic action. And something with a therapeutic action can also have side effects and adverse effects. And so we have to just at least warn our patients what they're going to interact with as far as other meds, herbs, foods and drinks, and let them make up their mind on whether or not they're going to use it. Now, the pros and cons of herbal medications, because they don't undergo that strict testing, we can't really vouch for their safety or their effectiveness or the purity of their particular mixture. Many drugs or many herbs and plants are found to contain natural estrogens. They're called phytoestrogens. Soy is a product that's really touted for menopausal women because they have these natural estrogens. Flax, red clover sprouts, which are sold in health food stores, if they have natural estrogen, using too much of them can interact and cause feminization effects in males. Some of these estrogens could produce growth of the mammary glands and can cause breast development in males. When it comes to herbs, we don't really know how long they're going to work, the amount or the length of time they should be taken. There aren't always clear guidelines. On the back, they'll see they give recommendations. And they'll say something like, take 2 of these daily as a healthful additive to a balanced diet. And so that doesn't really tell you a whole lot. Anybody who gardens knows that plants are at their best in certain times of the summer. You know that, especially if you grow herbs. I have a little herb garden out in front of my house where I grow like chives and rosemary and things like that I can use for cooking. There are times of the year where they grow differently. They've got a stronger scent. They taste different throughout the year. And sometimes they're very weedy and not really good at all. And you can't always vouch unless you grow your own herbs and supplements. You can't really vouch for what time of year they're harvested, how much of the active ingredient is in it, and what is leaves, what is the blossom from the plant, and what's just a bunch of stems. There is a group that's gotten together, and they call themselves Council for Responsible Nutrition. And they have developed guidelines that herbal supplement makers can voluntarily adhere to. And they give warnings on them about the dangers, like St. John's wort for depression can also be dangerous, and how some drugs can interact with anticoagulants. And a lot of for some reason, the drugs that start with G will sometimes interact with anticoagulants. So if you're taking something like Coumadin, but you eat a lot of garlic or take ginseng, you can end up with increased bleeding risk. And so this Council for Responsible Nutrition will voluntarily put these cautions on the label. But they have to pay to belong to this, and generally you're going to end up paying a little bit more for a company that is part of the Council of Responsible Nutrition. I think it's worth paying a little extra for, but not everybody feels that way. This is another humorist. This is an Irish guy called Dara O'Brien, and he says, I'm sorry, herbal medicine. Oh, herbal medicines have been around for thousands of years. Indeed it has. And then we tested it all, and the stuff that worked became medicine, and the rest of it is just a nice bowl of soup and some potpourri, so knock yourselves out. Of course, it sounds better because he has an amazing accent, but it's true. You know, through the years, we have found that things that worked, we have adapted them, we've synthesized them in a lab, we have purified them, and been able to attest to their therapeutic reactions as well as their side and adverse effects, and we can control them to a certain amount. The rest of the stuff can just look pretty in a bowl on your table. So just, make sure you do plenty of reading and familiarize yourself with different herbal substances that your patients might come across so that you can teach them more effectively. This is, I think, an excellent source. This is another integrative cancer center. Memorial Sloan Kettering has an excellent reputation in a lot of different areas of medicine. And they have come up with this Integrative Medicine Center where they've done a lot of research about herbs, and they talk about actions and interactions. And you can actually go to this webpage. I've sent you the link. If you end up like having to do drug cards for your clinical, I know you'll have to do them for mine, and I think you do them for some of the other instructors. If you have, a patient who's taken St. John's wort or saw palmetto, something like that, you can go on this website and it tells you all the things that you need to know about that.